Bridging Access to Care is a Brooklyn-based agency that provides a spectrum of clinical, prevention education, and mental health services to at-risk communities. Founded 25 years ago, the agency has responded to the changing requirements of its original constituency, people affected by HIV and AIDS. Glenda Smith is the executive director and spoke with us at her agency's Brooklyn offices.
Hi, I'm Glenda G. Smith, and I'm the Executive Director of Bridging Access to Care. Right now, BAC has been 25 years in the business. We used to be the Brooklyn AIDS Task Force, and now we are in the process of rebranding ourselves. Our business 25 years ago, and still is, matter of fact, is HIV and AIDS. Now we are expanding our services to do much more than just HIV and AIDS or just working with the HIV and AIDS population. We now have mental health, substance abuse, housing, a whole host of other services that we provide. It is now time to get the word out and let the community know that we are much more and bigger than just HIV/AIDS. Right now, the agency is rebranding, focusing on, again, not just HIV and AIDS, but also on other health disparities that's out there. STDs, substance abuse, mental health services, everything else that we do, we want to let that's specific to, not specific to HIV positive clients, but also to the non-HIV community. We want the community to know who we are and what we do and that we do it well. I remember a client who came in, he was positive, substance using, and it took us a while to really, he fell down, he got back up, he fell down, he got back up, and now when you see him, he has really turned his life around. I think it's important. That makes me say, you know what, how many more people are out there like this particular client and who needs our help and who needs us to be patient with them as they go through the struggle, as they go through this different changes. How many more? And I think there's a lot more people out there who need our help. We can do it. We have the compassion. We have the resources, the skill set to do it. And that makes me go on. That makes me say, you know what? Keep doing what you're doing. I would love to see our services and our agency to be more independent so that we are in one location and that we are not all over the place. I also would like us to add on more services like for STD, testing, and even treatment. I think that will be ideal for us. It will complement the services that we already do. And I think if we can just service more non-HIV clients to expand those services, I think we will be awesome. I think when people come into BAC, I think they see that we are caring folk. We are people who are agency that really looks out and really concerned about our clients. I think our staff are, I think the staff that work here are the best staff there is, and I'm sure all CEOs think that as well, but I really think our staff is the best staff that there is. They're concerned. I think that if I want another CEO to know about us is that we are innovative, we groundbreaking, and I think we're ahead of our time. Well, the message that I want our families and consumers to know is that, yes, we changed our name, and we are no longer the Brooklyn AIDS Task Force, but we still deliver concrete services. We still deliver services to the folks who are HIV positive, who are full-blown AIDS. We're still here for the community, but we also are doing so much more. Substance abuse, mental health, we have it, and we still do it with care. We still do it with the quality of services and with excellence. Now that you had gotten help from us, how about going back and helping someone else who's out there who used to look like you, who used to be you, and you're gonna pull them up and help them to get where you can be at right now.